I'm honored to be here with our Health Commissioner, Dr. Lena Nguyen, and Councilman Brandon Scott, the lead sponsor of the bill that I will be signing momentarily. In Baltimore, we are committed to making sure that our residents are served only the food that is absolutely safe for consumption. Our health department continues to be vigilant in holding restaurants and other facilities accountable. This year, the health department has already closed about 40 restaurants for health code violations, but some of the establishments closed for these violations place misleading signs stating they're closed for vacation or closed for renovations or out fishing, rather than simply telling the truth. That's why I'm very proud to sign legislation today that will end this practice and bring more transparency to business operations, ensuring that residents have the information that they need to make the best possible decision for them and their families as far as where they go to eat. This legislation is about much more than restaurant food ratings. It's about setting the tone for transparency, and that tone matters to Baltimore families, both in how government operates and regulates, as well as how businesses in our city provide services for our residents. This legislation builds on a foundation that my administration has set for greater transparency. I've signed into law executive orders that have delivered more transparency across the administration. I've significantly added staff and funds to the Office of the Inspector General so that he can conduct more investigations. Simply put, transparency works, and government must set the right tone. I want to thank Councilman Scott for his leadership, for his perseverance and his tenacity on this issue, and for all of the work that he did, not just to get it passed, but to get it to the place where we're ready to implement. And with that, I will turn it over to the lead sponsor, Councilman Scott.
Thank you, Madam Mayor. Thank you for your support. Thank you, Dr. Nguyen, and the team from the Health Department for all their support for this issue. I think the mayor already hit the points, but simply this is about a better educated and more informed citizenry is a better citizenry. When we have our taxpayer dollars paying for health inspections, then taxpayers should know the results of these inspections. Also, when you look at so many of our neighborhoods that have food deserts, that have more active liquor stores than supermarkets, don't have access to fresh food, when you couple that with the fact that many of these closures happen in those same neighborhoods, it just exacerbates the fact that they don't have access to food, and the food that they do have access to may be dirty or contaminated. This is a thing that the citizens of Baltimore overwhelmingly want and support. They have been clamoring. They love it that it's on my social media, but now it'll be right there for everyone to see. And also this will create better business practices and make people support the businesses that deserve to be supported because they're clean. If you're going to serve someone food that has rat infestations inside of the establishment, we should not be supporting you. We should be supporting those people that are clean and serving people the food that they should be serving them. And with that, I'll be very short and pass to Dr. Nguyen.
Thank you.
Thank you. Good afternoon, everyone, and thank you very much to Mayor Rawlings-Blake and Councilman Scott for all your hard work in making sure that we are here today for this bill. So I'm really excited to be with you to mark this important step in making our health department, making our city even more transparent and responsive to our residents' needs. And I want to thank again our mayor for your leadership in championing health in all policies and making sure that we're strong and healthy as a city, and also your commitment to transparency and accountability here in our city as well. And thank you to Councilman Scott for being so responsive and listening to our residents and making sure that we answer their call when asked. Now, our job at the health department is to protect the health and well-being of our citizens. A critical part of being healthy is the food that we put into our bodies. Unsafe food has bacteria, viruses, and parasites that can result in severe illness. As an ER doctor, I have treated hundreds of patients with food poisoning and have seen people, my patients, with severe diarrhea and vomiting, abdominal cramping and pain, even kidney failure and death. Our environmental health teams license and regularly inspect every restaurant and food service establishment in Baltimore. We ensure that they adhere to health standards to provide food and drink that are safe and do not cause illness and disease and death. Every year, about 100 eateries in Baltimore are found to be serious enough violation that they have to be closed. What this bill does is to say that the public has a right to know about these eateries that are closed due to safety concerns. The information, as Councilman Scott mentioned, will be posted in a visible place on the door of the establishment using a sign like this that says very well and clearly that this is an establishment that is closed. This will also be posted on our website and through social media as well. So I'd like to clarify a few points. First, the bill does not have a financial impact on the city resources because the sign will be posted at the same time as the closure. And then the sign will be removed by our staff when the re-inspection occurs. So there's no additional staff time or travel cost that's involved. Second, the postings only affect the establishments that had violations serious enough to warrant closure. This does not affect the vast majority of business owners here in the city that do comply with the standards to be safe. Third, as our mayor emphasized, transparency brings accountability. Bringing non-compliant businesses into compliance improves the reputation of the industry and our city as a whole. At the end of the day, this is an issue of safety and informed choice for Baltimore residents. Citizens have a right to know why an establishment has been closed and that it has been closed, so that they can make their own choice about where they eat and drink. Through this piece of legislation, we can educate citizens about the circumstances that lead to closure so that the actions of the health department are transparent, based solely on the need to safeguard the health and safety of Baltimore's residents. Thank you again to our mayor and Councilman Scott for your efforts in making this day possible.
Thank you, Dr. Nguyen. Thank you, Councilman. We'll open it up for a few questions. No questions.
All right.
I love this. Thank you. Thank you for being here. Thanks again, Councilman.
Thank you.
You have to get your stuff.
I know.
Oh, I have to sign.
Oh, yeah, you gotta do that first, right?